This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hey, this is Jason Crowell from Norton Neuroscience Institute in Louisville, Kentucky. Thanks for joining us today on the Neurology podcast. Today, I'm very excited to welcome Emma Coomans and Elsmarieke van de Giessen. They're both at Amsterdam University Medical Center, and they are co-authors on a recent paper published in the journal Neurology titled Performance of a Flortaucipir PET Visual Read Method Across the Alzheimer Disease Continuum and in Dementia with Lewy Bodies. This was published again in the journal Neurology on November 7th. Emma, Elsmarieke, thank you both for joining us today.
Thanks for having us.
Yeah, thanks, Jason.
So we will get into the nuts and bolts of this paper in just a second, but just to try to set the landscape, if you don't mind, I'm going to try and summarize the background that I gathered from reading your paper, which is that this was basically a study about a newly FDA-approved radiotracer, Flortaucipir. And what this radiotracer does is it binds the protein tau. And what you were studying specifically in regards to this was how well radiologists do in terms of visually interpreting these imaging studies in three different populations. So individuals who were cognitively unimpaired, individuals with Alzheimer's disease, and then individuals with dementia with Lewy bodies. Is that a fair summary of the background?
Exactly. What we did is we focused on a PET radiotracer that binds very specifically to tau neurofibrillary tangles, which is seen in Alzheimer's disease. And this PET tracer called Flortaucipir recently received FDA approval to be used clinically and to support the diagnostic process in patients with cognitive impairment who are being evaluated for Alzheimer's disease. And to us, this is really a very exciting development, actually, because, well, Alzheimer's disease is characterized not only by tau, but also by amyloid plaques. But what we know from previous studies is that the tau biomarkers actually have a much higher specificity for Alzheimer's disease than amyloid biomarkers have. So the prospect of implementing tau biomarkers in the clinic is really very exciting, as this means that we can have a more specific biomarker that actually can be used to rule in Alzheimer's disease.
So what's the background for this? I know that we have some biomarkers available, right, for Alzheimer's. We have PET scans, we have CSF studies looking for amyloid. What else can you tell us about biomarkers that are already currently available in this disease?
Yeah, so I think Emma already mentioned that we indeed have good biomarkers for Alzheimer's disease for amyloid. And indeed, usually that's done with PET or with CSF. And are great developments in plasma biomarkers for Alzheimer's disease, although they are not validated yet. So they are currently not available yet. But I think the great thing that Flortaucipir or tau PET adds to this is the high specificity. So whereas amyloid biomarkers are really good in ruling out Alzheimer's disease, the tau PET is really good at confirming the disease or ruling in Alzheimer's disease or Alzheimer's disease pathology in the brain. And it's really strongly correlated with the symptoms as well. So it also has a prognostic value to it. And we did not only do Flortaucipir scans in patients with ID, but also in cognitively unimpaired patients and patients with DLB. What we saw is that for the AD patients, we really see a high percentage of the group that has tau positive PET scans and that we can really confirm the pathology and the disease. For the patients who are cognitive unimpaired, it's more difficult. That there is a lower percentage that's tau positive. And actually, in the clinical use, I think for cognitively unimpaired people, you maybe more often want to rule out the disease and more often use amyloid biomarkers, whereas at least do that first. While for symptomatic patients, when you want to confirm the disease, you can use a tau PET. And DLB is a different group. So DLB, of course, we have different biomarkers like a dopamine transporter SPECT imaging or presynaptic dopaminergic PET imaging like FDOPA PET. And also upcoming there is the CSF measure of alpha-synuclein that's under validation now and possibly also coming to the clinical field. And that's really a good biomarker for confirming DLB. But we know that in a substantial subset, like 30 to 50% of the DLB patients, there's also amyloid pathology. So it is interesting to see whether there's also tau pathology. But what we saw, and also other literature shows, is that the tau pathology there is usually rather limited. And we also had in this study only half of the patients who were tau positive. And then their tau load that we quantified with SUV ratios was also pretty low. So actually, tau PET in DLB is not the ideal biomarker. Like you would rather go for the dopaminergic imaging and for the alpha-synuclein imaging and possibly co-pathology with amyloid, but then choose an amyloid biomarker. So to summarize it, I think the tau PET is really great to confirm Alzheimer's disease in symptomatic Alzheimer's patients, but other biomarkers are good, like the amyloid or the dopaminergic imaging in the cognitively unimpaired or in the DLB patients.
What else do we need to know about this radiotracer Flortaucipir? I have to admit, this is the first time I've heard about this. Is there any other aspect of this we should know?
So this radiotracer Flortaucipir became available, I think, in 2014 or 2015. And since then, lots of research groups have been doing very valuable research with this tracer. What we know is that this radiotracer very specifically binds to tau aggregates that are seen in Alzheimer's disease. And this tracer binds a bit less well to the tau aggregates seen in other tauopathies, such as primary progressive PSP or CBD or other tauopathies. So this tracer is really valuable for distinguishing between Alzheimer's disease and non-AD dementias, making the diagnostic value very high.
So let me just clarify, Emma, you said that this radiotracer is specific to tau in individuals with a clinical phenotype of AD, so this would not show positivity in individuals with, say, progressive supranuclear palsy or corticobasal syndrome. Is that right?
Exactly, that's right. So this tracer has very specific binding characteristics for the 3R, 4R paired helical filament tau aggregates. And this is specific for Alzheimer's disease. And for example, the other tauopathies, which are mainly composed of 4R tau aggregates, then this tracer binds less well to the tau aggregates. So we do see some binding there, but it's far less and it's almost in the noise range. So it's much more difficult to disentangle true tau binding from the noise that we sometimes see on the scan. So if you want to, there are some other tau tracers available that seem to be a bit better for other tauopathies. But I think this requires much more research. And also these tau tracers are not yet at least FDA approved. So they cannot be used clinically, at least now. For the Flortaucipir tracer that is clinically approved, it's much more specific for AD type tau.
And so when you give individuals this radiotracer, where on the imaging do you expect to see this radiotracer show up? Is there a typical pattern and locations in the brain in individuals with AD?
Yes, absolutely, because this is also part of the visual read method that we further validated. And actually the tau pathology in Alzheimer's disease, it follows the Bragg stages. Usually it starts in the medial temporal lobe, but then spreads to the lateral temporal part and then spreads to the parietal part. Occipital may then also contribute, and some people also have frontal uptake or frontal spread of the neurofibrillary tangles. And this visual method that we tested in our study, that really is specific for the later stages. So when there is spread to the lateral temporal part of the brain and to the parietal part of the brain, that's when we call a tau PET scan positive or abnormal, because then there is already pretty widespread tau pathology, and that corresponds to Bragg stage 4 or 5. While the early tau pathology, when it's in the medial temporal lobe, then this visual read method still calls the scan not abnormal, because then the tau pathology is too little. And that's also the reason why this method is highly specific for the AD or the Alzheimer's disease diagnosis, because you really confirm the later stage Alzheimer's disease, so from Bragg stage 4. It really follows the pattern that we also see in postmortem research, and that's also how this tracer was in previous literature validated.
Very good. Elsmarieke, would you say once more, what are the areas that indicate that are late stage tau regions? What areas of the brain is that?
So the later stage tau regions are the lateral temporal, and then it spreads even further to the parietal and may also include the occipital part. And when those regions are affected, then we call the tau PET scan positive or abnormal. And then we really see the tau pathology that fits Alzheimer's disease diagnosis.
So specifically, my understanding is in this study, you were looking at inter-rater reliability and intra-rater reliability of interpretation of these tau PET studies. So what did you find?
That was quite an important aspect of our study. So what we found was that this visual read method, it yielded a very high inter and intra-rater reliability. If I'm correct, I think there was disagreement between the readers in only 8 out of 368 scans. So that is really very low. And I think having a very high inter-reader agreement is very important for a visual read method, of course, or actually any method that you apply clinically, because you don't want the outcome to be dependent on the reader. So I think that's a very big advantage of this method. And I think the reason why these inter-rater and also intra-rater agreements are so high is because it's very clear when voxels or sets of voxels should be considered tau positive and when they should be considered tau negative. So for this method, you have to draw a region around the cerebellum, and then the cerebellum is the reference region. And everything that has a signal of 65% higher than the signal in that cerebellum is then considered as being tau positive. And the result is that it's just very clear when voxels exceed this threshold. So I think that's a very big advantage of this method and makes it quite easy to interpret.
Yeah, and if I may add to that, I think that also really helps to have the method and also the applicability of tau PET easy to spread to other hospitals, because it's really easy to learn. So it's easy for other radiologists to adopt this new tau PET method, the visual read method that is related to it.
So based on what we've talked about thus far, you're mentioning the specificity of this test in individuals with Alzheimer's disease. What I would hypothesize is that when you looked in these three different populations, so cognitively unimpaired individuals, individuals with dementia with Lewy bodies, and individuals with Alzheimer's, I would suspect that the test would be typically negative in the cognitively unimpaired folks and even in folks with dementia with Lewy bodies, but then positive in the Alzheimer's cohort. Is that indeed what you found in the study?
Yeah, I fully agree with what you say, that in the group of Alzheimer's disease patients, almost all patients had a positive scan. There was only a minor group that had a negative scan. And actually what's quite interesting, that this is a group of older and more often male patients. We're still looking into it, but it seems that this small group of patients who had the Alzheimer's disease diagnosis and were amyloid positive, they may have less resilience to the amyloid pathology and still an earlier tau pathology states while they are already symptomatic. But yes, indeed, for the Alzheimer's disease group, the large majority was tau positive. For cognitively unimpaired, as you already mentioned, most of them were tau negative, although we know that the cognitively unimpaired people that are amyloid positive and tau positive, they really have an increased chance of cognitive decline in the upcoming years. So if you see it in this group of cognitively unimpaired people and they have a tau positive scan, it's relevant for their prognosis. But I would recommend in a cognitively unimpaired group to always first do the amyloid biomarker, because that's more important to know and exclude Alzheimer's disease in this cognitively unimpaired group. And indeed, for DLB, we had about 50% of them tau positive. But for DLB, first go for the other biomarkers. And it's also borderline positive in most of these patients. So for the clinical situation, I would recommend going for a tau PET when you really have a suspicion of Alzheimer's disease and want to confirm that.
I fully agree. I think based on the hypothesis that tau PET has such a high specificity for AD, I think it was quite interesting that we did find quite some DLB patients who have a positive tau PET scan. But if we look at the actual quantitative values of these tau PET scans, so estimating how much tau load there actually is in the brain, these values were still really, really low. And so the positive patterns that we saw in DLB were quite vocally abnormal, with very few voxels being abnormal, or relatively few voxels. So I think it would definitely be interesting to have a closer look into these patients to see whether the binding that we see on those scans that lead to a positive tau PET visual read, whether it's truly binding to tau or whether it's maybe binding to something other than tau. And I think for that it would be, most interesting to see whether at some point there are some postmortem data available to see is there really tau there or not, especially because the quantitative values were so low. So we have to be a bit careful in the interpretation of those tau positive scans there.
Very good. And so if I can just recap what I learned from this radiotracer is FDA approved. It is pretty specific to the AD population. It might not be useful as a screening tool, but it could be useful in confirming Alzheimer's disease in someone with cognitive symptoms. And when you studied how well radiologists did in interpreting these studies, there was great intra and inter-rater reliability. Anything else you can think of that would be useful for our audience to know about?
Yeah, so maybe one thing to add that we did not touch upon yet is that almost all individuals that had a tau positive scan were amyloid positive. So out of all tau positive cases, there was only one individual that did not have amyloid pathology. So I think that's really a strength, that if someone is tau positive, there's a very high chance that that person is also amyloid positive, given the very strong link. And the other way around, it's not the case. So not all amyloid positive cases were tau positive. I think this really adds also, again, to the diagnostic value that tau PET has a very strong value to rule in Alzheimer's disease. If you're positive on tau PET, you are very likely to have both widespread tau pathology as well as amyloid pathology in the brain. And then additionally, what we did not really touch upon was that a positive tau PET scan is also associated with a steeper cognitive decline, indicating again that tau PET also has prognostic value. And I think that is very interesting, as we currently do not have a lot of biomarkers that show very strong associations with cognition that are used clinically. So I think it would be very interesting to further look into the prognostic value that tau PET has and how we can implement this in the clinic.
Well, I think what's also very interesting to think about in this respect is there is currently a quickly changing landscape that with disease-modifying therapy is becoming available with the anti-amyloid antibodies. And what we see from the first results in these trials is that when they look at the tau load in the brain, so the tau pathology in the brain, they use tau PET scans, and they see that the patients who have the best response to the anti-amyloid therapies, that those are the patients with intermediate tau load. And whereas the patients who have a high tau load, that those patients do not have so much benefit from these disease-modifying therapies. So actually, it's also still a question for us in this quickly developing field whether tau PET will get a place in this therapy landscape, because it's important for the patient selection to select the patients who will have benefit from the treatment, whether they are intermediate or high tau load patients. So it might even be that tau PET will also there get a place in a clinical use for patient selection of disease-modifying therapies. And then also the visual read will likely be used.
Oh, interesting. So it might have some prognostic information when considering whether or not to proceed with anti-amyloid treatment in these individuals with Alzheimer's. Very good. All right. Well, thank you both so much for joining us. I feel like I learned a lot today. Again, the title of this paper is Performance of a Flortaucipir PET Visual Read Method Across the Alzheimer's Disease Continuum and Dementia with Lewy Bodies. Again, this was published November 7th in the journal Neurology. I've been speaking with Emma Coomans and Elsmarieke van de Giessen, who are both at Amsterdam University Medical Center. Emma, Elsmarieke, thank you both for joining us. Really appreciate it.
Thanks for having us.
Thanks a lot, Jason.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.